Today is a welcome for everybody who comes in to my channel. I'm wanting to focus on health and wellness on my channel, maybe some day-to-day activities, but for starters, I'll tell you why I made the channel. I was speaking with one of my sisters, I have quite a few, and she started a channel for her health and wellness, and we share a few conditions. And even though we share the conditions, they are completely different and apparently tailored to each of us. I'll start by giving you my diagnoses and the current treatments. For one, starters, I was diagnosed with diabetes when I was 28 from a bout of ketoacidosis that was brought on by prednisone, a steroid. I spent 2 weeks in the ICU. After that, I was told I was diabetic. For about 9 months, I did everything I was supposed to do to keep myself healthy. And then all of a sudden, it went away. I didn't have any problems with diabetes. And about 2-3 years later, it came back, but came back wonky. And I'll explain why. So for the majority of the year, my blood sugar, I have the hardest time keeping it up. I will literally eat a bowl of cereal, a candy bar to try to bring it back up. When I say up, I mean I go down to the 40s. And also, I don't feel it until it gets down that dangerous level. So I have what's called a continuing monitoring device, which is a Dexcom G7, and I wear that on my body, and it tells me what my blood sugar is. It also tells me when it's going too high or going too low. I hear that low quite often. So I have to be very careful because this can happen when you're asleep. This can happen anytime. And the consequences of it going too low or can be devastating, can be very bad for you, as well as it goes too high. That is something that I will be talking a lot about because I was just informed by my endocrinologist I'll be put on an insulin pump. And when we do that, I will make a whole video on it. The second thing is fibromyalgia. Musculoskeletal nerve pain disorder. Your body thinks that you're in pain, so your brain sends pain signals to your nerves, and it causes widespread body pain. There's no cure, and they really don't know why the body does what it does. With that, I'm in pain 24/7. I don't go lower than a 6 or 4. I'm sorry, my cat, it really wants to be in the video. I don't go lower than a 6 or 4 or 6. Well, it used to be a 4. We change medications quite often because my body gets used to medications so quickly that they just don't work after a while. So we just changed it from Percocet to Valium, however you say it. And we hope that works for a while. I also use lidocaine patches, which can be very irritating to the skin. I'm allergic to so much, especially things that go on topically. Let's see. I also have hypermobility in my joints, which is commonly called Ehlers-Danlos syndrome, but it's a very mild case other than the fact that I still dislocate. I don't have some of the characteristics. So they, instead of calling it Ehlers-Danlos syndrome, they call it hypermobility. Then we're gonna go into reproduction. I have polycystic ovarian syndrome. I'm going to talk a lot about that because it does so much hormonally to my body that it's a constant reminder. And endometriosis. I've had surgery for endometriosis. It only helped for a little while, came right back. Let's see. And degenerative disc disease in my lumbar spine, which is your lower back. I get steroid injections for that. We changed the steroid so it does not cause as much problems as a prednisone would. So we get that done every 4 to 6 months. And what I can liken the pain of it to is somebody having a knife and just digging in your back. And so that's also symptom, that sensation that I get. The sensation I get from fibromyalgia is more of a, come here. This is T'Challa. If you know, you know. Somebody left him on the road to our property, and we have a soft spot for cats in this house. You'll meet my other cats, my dog. Yeah, so these issues, I'm told there's no way to know how, except for the diabetes, could be genetic. And the polycystic ovarian syndrome can be genetic, which I'm not the only person with it in my family. It's very prevalent in my dad's side of the family. Fibromyalgia and other nerve issues, and rheumatological issues are common in my mother's family. So I basically got a raw deal here. I am also a late life baby, and I'm told that late life babies tend to have more issues health-wise. And if you ask me, that's true. I am constantly at the hospital for something, IBS, pain, migraines, chronic migraine syndrome, or for body pain that can't be managed. I mean, it gets to the point where the only thing you can do is lay there and cry. And so I really want to make these videos because I don't see a lot of people who look like me talk about this. If they do suffer with it, they usually suffer in silence because a lot of people don't consider you disabled when you don't have a physical disability. As far as that someone can see, because fibromyalgia is a physical disability, but one that you can actually see a person having an issue with. So if I'm parking in handicap, I get looked at weird. I've only had someone say something to me once, and that day they learned. That day they learned. So that's what I want this channel to be. Is hopefully I'm not a medical professional anymore. I was a medical assistant and a phlebotomist, and I worked very closely with a few different kinds of doctors, oncology, rheumatology, private practice, as far as like PCP, and also ER, the ED, the emergency department. So I can speak on some things, but only take that with a grain of salt. I am not a doctor. I can tell you what I do, what I go through, and give you that perspective. But everybody has their own journey. Everybody's body's different. You can have the same thing as me, but your diabetes might be totally different. Mine is called brittle diabetes. He would say that I have characteristics of both 1 and 2. And also I want to talk about mental health. I know that my mom's not going to like me telling people my diagnosis, but I'm going to say it anyway. I have schizoaffective bipolar type. I was diagnosed in 2015, I believe it was, and I'm on medication for that. I have really bad anxiety about a lot of things, and it can be crippling at times, especially depression. So I'd like to talk about things like that as well on this page, on this channel. If you guys want to hear more, let me know. Thanks. You have a good day.